to Health Talk here on AETV Live. My name is Ogaga Ikama, and I'm still very much your host. I've still got with me Nurse Praise Isu, and we are still shining, beaming the spotlight on vaginal delivery versus Caesarean section. Okay, so in the previous episode, you talked about reasons why vaginal delivery might not be considered as the first option anymore. Multiple gestation, prolonged labor, placenta abrupture, fetal distress, and all of this. You also mentioned something else, that placenta can block the cervix. Yeah. So now, and while you were talking about these conditions or these situations, you were mentioning Caesarean section. So first question, apart from the vaginal delivery, is the only left available alternative the C-section?
I think is the most popular next after that Caesarean section. You know that when we talk about vaginal delivery, we talk about the other types.
Yes,
we talk about induced. So I think next after that is actually the Caesarean section.
Okay, so what is the Caesarean section?
Okay, so Caesarean section is a surgical procedure whereby an incision, or rather an opening, is made in the abdomen and the uterus through which the baby is born.
Okay.
Yes.
So the opening gets to the uterus as well?
Yeah, so basically they open the abdomen. That's
stomach, continue.
Because they have to go deep now, so you open the stomach.
Not necessarily this.
No, exactly.
Not necessarily the stomach,
right? It's an organ.
True, right?
Another thing, so you open the abdomen, that's the right terminology. You open the abdomen, then you now get to the uterus, then you make an incision in the uterus, which is the womb, then bring the baby out of it.
Why is it C-section now? It's an alternative. So what or who determines the birth and delivery procedure?
Okay.
Is it the hospital, like the yes, or is it the patient involved, or
okay? So who determines?
Or maybe the spouse.
Even if the doctor recommends that you should have a C-section, nobody's going to tie you down or force you. You have a choice to say, I want to do it or not. So the consent is with the woman.
Okay.
Yes. So the woman makes a decision whether she wants to go ahead, but the doctor makes the recommendation. He's the one in charge. He makes the recommendation, but she has just to say, I want to go ahead or not. Then also she can also decide, I want to have an elective Caesarean section. I just want to, give it to my baby through CS. Then on the matter of consent, right? There was this story that was trending on social media. I don't know if you saw it, whereby a woman was pregnant, she was time for labor, got to the hospital, and the doctors recommended that she had a CS because of some factors, like I said, that would put her at risk if she gave birth vaginally. And the doctors recommended that she had a CS, that's a Caesarean section. And she wanted to have it, but the husband categorically stated that his wife will not have a CS. Now we have these myths whereby they say that if you give birth to like Hebrew women, if you give birth per CS, it's wrong. Must give birth naturally. And in that period of back and forth, making her husband to agree, refuse to give consent for the woman to have the CS, the baby died and the woman died. So it's actually an issue.
Okay.
So women have the sole right of making consent, whether they would.
If she's married now, this is not just a sexual partner.
Yes, this is
okay.
If she's married, WHO says that women have autonomy and a right over their health as far as she is mentally stable, and she's in a state of a normal state. She's not in a place where
she's in a conscious state.
She's in a conscious state, exactly. She's in a conscious state. She can make decisions. Then she can make, she can sign consent for her to have Caesarean section. The only time where the legal representative or legal guardian takes charge is if she's incapable at the moment to make that decision, or in emergency situations. So, for example, if the woman just stumbles unconscious and wants to do decision, the next person is her husband, who is her legal guardian or legal representative, they can now say, with or without the woman's consent, of course, because she's unconscious, she can say, okay, I want my wife to have a CS. But only in that kind of situation, when she's incapable or it's an emergency situation and she's not able to make that decision, then the husband can step in. But aside from that, if she's stable, conscious, mentally okay, she is the one that has the right to decide if she wants to have a C-section or not.
Okay, so from the summary of what you just said is that when it comes to the determination of the delivery procedures in relation to C-section, all other individuals involved can just recommend. It's the woman that has the right to say, okay, this is what I want.
You recommend for her, then she gives her consent for them to go ahead with whatever they recommend. So even if they recommend and she doesn't give consent,
you have to stick with what she says.
So, but when you recommend that she gives consent, then you go ahead with the procedure.
Okay.
So it's more like a partnership between the patient and the healthcare provider, which is the obstetrician.
Yes. So I've also heard ladies that say things like, I want to have all my children via CS for raising specimens to them. Maybe later we delve into, I want to have all my, maybe because they don't want to go through the stress of pushing. Then there is another myth that maybe much later I'll bring it up and we talk about. And so they say they want to have all their children through C-section. Now the question is, how many C-sections is safe for an individual to have in a lifetime? Or you can have as many as you want.
Okay, actually, according to World Health Organization, which is WHO, there is no particular number of children can have C-section, but there's a clause. It says that if you have after three and above, 3 plus, you're at higher risk. You know, if you have multiple C-section. So that's just the clause.
Because I was going to think like, so if it's somebody that, especially parents of old, that can have up to 7, 10 children from one. So the incision, like,
you're at risk if you have
to cut. Like when you just open.
So you're at risk if you after 3 and more. So it's a limited number. I think because of that risk, you're not able to have as many children as somebody who's giving her vaginally because the risk is higher.
Okay.
So after 3 and above, you get to be at risk.
Alright, this is still Health Talk here on AETV Live. The conversation still on vaginal delivery versus Caesarean section, and this episode has majored on the C-section. If you missed the previous episode, which was majorly on the vaginal delivery, please do have to check it out. And in the next episode, we'll be talking about recovery from vaginal delivery and the C-section, and we'll also look at the advantages of both delivery procedures.